Good afternoon, everyone. Thank you for joining us on this Facebook Live on the WFSB Facebook page. I'm joined today by Carissa Spada, and you are a licensed massage therapist at the Center for Advanced Reproductive Services.
Yes.
Now, I have to say, I've done many stories with the center, and every time I talk to somebody from the center or I go there, I'm just blown away by how many things that you guys do. It's not just, you're not just a patient, you're just not just a number.
Yep, absolutely.
The center really has so many innovative and holistic ways that they help patients realize their dream of having a family.
Absolutely, and their eyes are always open for more and what else and how can we best help and how can we best support. So I have the same feeling because I walked through those doors as a patient at one time. And now I walk through as a yoga teacher and a massage therapist, so I feel the same way. It's just always growing and it's really special.
So now that brings us to, you're a licensed massage therapist with the center, and there's a new program that you guys have.
There is, yeah, and we're really excited about it. It was something that I sort of sought out myself because I thought, man, there must be something in the massage world that's more geared towards fertility. And it did take a little bit of searching. It doesn't seem to be everywhere possible. And I found a training and did have to go down to Baltimore to take the training and do some work that way to be able to bring it here. So now we've got it here, and it's a really special program. It's special in that it's not a traditional massage at all. We almost have to educate people, like, don't expect to get a full, head to toe
no, like
massage
deep tissue,
here.
back massage,
not gonna happen,
none of that.
Exactly. But it's really unique. It's a very specific protocol. It's got a lot of different elements. So it's got reflexology and acupuncture, and we do a castor oil pack and guided visualization, and very specific towards the goals that somebody is working towards. So it's a new program, and we're really excited about it.
So now take me through, because it is different. It's not your traditional massage.
Yes.
So take me through, a patient comes to you from start to finish.
Absolutely. So when somebody comes, the first piece of it is a pretty fair amount of conversation around lifestyle. So it's really important for me to know, are you just thinking about family planning, or have you been receiving treatment for 5 years? So I need to know, A, where you're at, what you've gone through, and then what are some things that we could do to maybe help you at home? So what are some lifestyle things? So that's the first piece of it, is a fair amount of history and conversation, and really focusing on that piece. Then you're gonna go onto the table, you're gonna get a castor oil pack, which is castor oil on your belly with some heat, and it's really comforting. I know everyone hears castor oil and they think they're going to be like ingesting it, but you don't have to drink it, I promise.
Just a pack on your stomach.
Exactly.
Okay.
And then some heat. And then we're going to do some cranial sacral work, which is really grounding and relaxing. Do some guided visualizations as well, so you'll be getting some cranial sacral work with guided visualization. Then there is some relaxation portion with the neck and shoulder, so you do get a little bit of that feel-good massage piece. There's acupressure that we're going to go down through the arms and find the different meridians and work there. Lots of reflexology, so I spend a lot of time at the feet. So it is relaxing, and then it's also very specific to the protocol that we're working with. And then there was a few more pieces, and then we're going back to the belly and doing very specific abdominal work to increase digestion and help with blood flow. Then there's some low back work and trying to, break up any adhesions or tightness in the low back and pelvis. So there are some massage elements, but then we're really putting in all of these other pieces. So
now, why does this work?
It works because we're helping to set the best possible conditions. So we're looking at, again, are there some lifestyle things that may be very obvious to somebody in this arena who's thinking about fertility all the time, but maybe not as obvious to somebody who's not thinking about that.
What would be one of those things?
One of the things would be, are you sitting all day? So if you're sitting all day, you really don't have a lot of blood flow through the pelvis. And so you can get congestion, and there's a lack of oxygen and blood flow. So I would say to somebody, if you've got a job that requires you to be sitting all the time, you need to be getting up more. So you need to be doing more trips to the water cooler, maybe some leg swings, so something that's very simple.
Yes, that is so. I mean, if you're out there and you're thinking of starting a family, I think most of us sit all day. If
yes,
you know, if you have an office job, you're driving, if you have a long commute, that's a great piece of advice that I don't think people out there would have realized.
Very simple. My philosophy always when I'm working with somebody is what are some really tangible, doable things that aren't extreme. Nothing is extreme, but they're things that can make us feel like we have some control here and we have some opportunities to shift things a little bit to help to set the best possible stage, sort of stacking the cards in the right direction. And that's really what this is about, stacking the cards in the right direction.
Mm-hmm.
Yeah.
What are some of do you see any other benefits from people that they come and get this done?
You know, I think one of the biggest benefits, honestly, is that the sessions are anywhere from an hour and a half to 2 hours. And so they're longer sessions.
Oh, wow.
So to have a focus for almost 2 hours, sometimes 2 hours, on you as a person, what's going on in your life, the specific journey that you're on. We're talking about it. We're talking about the lifestyle things. We're talking about the emotional pieces, the stressors, the challenges, maybe some emotional blocks that are coming up, things that we tend to not think about. But when you're talking with somebody who is, again, really focusing on what your goals are, that's one of the biggest benefits, too, is that you've got this chunk of time where you've got somebody else with you in partnership focusing on your goal.
And listening. How many sessions typically does a patient have?
You know, in an ideal world, the sessions are really unique in that they have to be timed. So they have to be after the end of a menstrual cycle and before ovulation. So there's actually only, in a month's time, there's really on average maybe 8 days that somebody could have the session. So they can certainly have regular therapeutic massage, relaxation massage at any time.
But this particular
this particular protocol has to be during that time. So in an ideal world, they would be seen during that time 2 to 3 times. That would be ideal. You know, over the course of a few months, even better. So it's always wonderful when somebody starts thinking ahead of, oh, I'm thinking about building a family, or we just started trying. That's a really fantastic time. And often it's the opposite when we've been trying for a while and it's like, you know what, I need a little more support.
Something different.
Something different.
Try something different.
Exactly.
And I mean, there's no downside.
There's no downside. And I'm certainly not trying to build a family, but I received it many times in the training process, and it is so relaxing. I would get a fertility massage any day of the week because it's grounding. You've got warmth on your belly. You've got the shoulder massage. You've got all this acupuncture and reflexology, and it's really a holistic, complete experience. So I highly recommend it.
Now, you guys have a grant now that you...
We do, which is really exciting. And so it's an opportunity for people to apply for themselves, or if they know of somebody, maybe their daughter, maybe a friend that they see going through this process and they want to apply on their behalf. And so they get to apply online, send in their application, and then somebody is picked every quarter. And that winner will receive 2 massage sessions. And we really wanted the 2 because that's more of a treatment to have those 2 sessions during that sort of roughly 8 to 10 day period. And then we'll pick somebody different every quarter. And I think that what I realized recently was that even the application process can be therapeutic in that you're writing out your journey, you're writing out how you got here, you're writing out what you overcame. And so even in the application process, I think that can be a supportive experience.
Right, because it gets you thinking about it.
It does. And I am not on the panel for picking, and I always say thank goodness, because if I read everyone's
You would
story,
want to give it to everyone.
Exactly. I'll just do massage 24 hours a day. Exactly.
Now, you have a unique perspective, I think, that there are other providers at the center that have been through fertility treatments.
Yes.
How do you think that helps you to treat these women who are going through it?
I think it's a game changer in some ways of being able to really be in somebody else's shoes. And this is actually why I sought it out. I don't think that this is where I don't think I'd be sitting on your couch right now if I hadn't gone through it myself. And so, especially when there's a struggle, I mean, certainly some people try to family build and there's not a struggle, and that's wonderful. But when there is a struggle, and for us, there was a struggle and there was treatments, it's really healing for me to then give back. It's like whatever I learned, whatever I experienced, if I can now give back, support, have an open heart to to getting that it's challenging. So I always say that I really love to walk through those doors, and now I'm, not a patient anymore and have two beautiful daughters as a result of the really miraculous work that the center does. And so for me, it definitely has an impact having gone through it and knowing the roller coaster. It's like most things in life that we don't really understand unless we've gone through it ourselves. So it does lend that extra piece.
And now, if you're just joining us on Facebook, I'm with Carissa Spada, and she's from the Center for Advanced Reproductive Services, and we're talking about this new massage therapy program that you guys have. Yep. But if you have other questions and you're watching and you have a question for Carissa, feel free to ask them. We'll ask. We're on live right now, so you can. You also do yoga.
I do.
So
yes.
How do you think that helps prospective families?
Yeah, absolutely. It's all yoga is stress relieving, and so that's a huge piece, is to be able to go through this process and find ways to reduce stress. And so the yoga certainly reduces stress, and the yoga that we do at the center is a little bit more unique in that, number one, you're practicing with all other women who are in a similar position. So that's
so important.
It really is. And because anything that has potential to be challenging or unique can feel isolating. And so now here's already a chance that we get to do this together. We do start the yoga classes with the opportunity for just saying our names and where we're at in the journey, certainly, or just our name and past is fine too. And then we focus on postures that are either very grounding, a chance to relax, some visualization, and also yoga poses that, again, help sort of open up the pelvis and get blood flow. And so we're really specifically focusing on the same goal together. And because I do love doing massage therapy, and I love massaging faces, actually, I end the class when they're in relaxation pose with a little facial massage as well. So it's a really complete experience to come in and take a class there, and it's another offering of the center, which is really beautiful.
And I said it at the beginning, but I'll say it again. I just think it's wonderful, the holistic approach that the center takes to each and every person that walks through their door. What are some of I know you do yoga and you do massage therapy, but can you talk a little bit about the other things that the center offers that maybe aren't your typical sitting in a doctor's office and getting blood drawn?
Yep, absolutely. And one of the biggest ones, which is so wonderful, and the woman who provides it is so amazing, is acupuncture. And that one is so great because I think that we as a culture sort of understand the benefits of that more. And so people are already, when they hear the word, it's like, oh, I see how that can help me. And then she's available for right before transfers and right after transfers. So that's just another piece of an opportunity to get more support. And we have a health coach, and it's the sort of long list now.
Reiki, everything.
Exactly, of just like, how can I best, and that is what they are looking to do. So they know that going through this process can be challenging at times, and how can we best support our patients as a whole person, not as a patient coming in, getting a treatment, and walking back out. And so it's really
And I think
special.
all of that speaks to why the success rate is so high at UConn.
Yes, exactly. Yeah. It just keeps climbing, and the innovations and it's really spectacular. I tell people all the time that when you live so close to something, sometimes you lose sight of how amazing it is that we live within this driving distance to this spectacular resource. I would not have my daughters if it wasn't for them. So it's no small thing.
And I've met so many families who have said the same thing.
Yes, they would not be here walking this earth without them, and that is not a small thing. And just to be able to be part of this, again, now on the other side is pretty special.
Now, if someone wants to find you or get a hold of you, how do they do that?
Absolutely. Probably the easiest way is my website, which is my first and last name, carissaspada.com, or my email, info@carissaspada.com. I try to keep it very simple. Of course, then you have to know how to spell my name. Or certainly the center's website has lots of links to me, and you can find me that way as well.
Which that's uconfertility.com, and I'll make sure that I post that in a comment below this video if you're watching it later. Okay, so a woman's out there, a family's out there, and they're watching this, and they're not sure.
Yes.
what's your biggest piece of advice to them?
Not sure in terms of coming.
Should they come see you, or maybe they're trying to start a family and they don't know if they need help?
Yep, absolutely. I think the biggest piece of advice is come and have one experience, because everything, while it is a specific protocol, it's completely tailored to the person, so that wherever they're going, wherever they're at, we get to have a conversation. So to come and see what it could mean for you, I can't really say enough about the experience that they would have. And everything is tailored so that if we need to shift, we need to stop, we need to add something else in, we need to focus instead of a half hour on what's going on, we need to spend an hour on what's going on. That's what we do.
And what is your number one easy tip that someone at home, they're trying, maybe they've been trying a few months, it's not happening. What's one little tip that you'll give them?
My one tip is to do one kind thing for yourself every day.
A great tip.
Yeah, one kind thing, one feel good. It can be anything from a bath to something bigger. Take a cooking class, do something fun to keep energizing yourself, and then you can move from there. And then, of course, they have lots of other, believe me, we could spend an hour talking about tips. And
well, I think that's so important, because I think women in general just kind of, they're so worried about taking care of everyone else that they don't do things for themselves.
Absolutely, absolutely. And everything in life is about balance. So even trying to conceive is about balance, is about hormone balances, it's about balancing time. Being a mother is about balance. So if we're starting off about balancing and then remembering to recharge and replenish and feel good, that's a great starting point.
So if you want more information, the website is yukonfertility.com. You could find out about this fertility massage program that Carissa does, how to apply for the grant, and any other information that you might need if you're thinking about checking the center out. It's a great place. Just go to yukonfertility.com. Thanks, Carissa, so much for speaking with me.
And thanks for watching.